Perfect. Okay. Well, we'll start and I'll say good morning and good afternoon to everybody. My name is Marcy Saxe-Braithwaite. In my day job, I'm the Associate Vice President for Executive Search for the Medfall Group. And I want to welcome our audience, and I know there'll be more people joining us. Today, we're going to present a tutorial for potential authors on how to publish. And I have two of my guests with me that will introduce themselves as well to all of you. We will ask that you wait till the end and we'll take questions. You can put them in the chat or put your hand up. It helps with the flow for the presentation if we take questions at the end. So write down your questions. If there's ever a need to interrupt us, our admin will be there and she'll know, but I hope you'll enjoy today's session. And I'm going to ask Don and Ron to each introduce themselves. Don Juzwishin he's the current board chair for Healthcare Management Forum, and Ron Lindstrom is the past board chair. And both of my colleagues here are very well versed on what Healthcare Management Forum is and how to publish. So it's a pleasure to meet with both of them and share their wisdom today. So Don, could you start and introduce yourself in a couple of sentences?
Thanks very much, Marcy, and welcome everyone to the webinar. So I live on Vancouver Island. I'm adjunct professor at the University of Victoria, teaching in the Health Information Science program. I'm on the board of directors of the Health Research Data Network, which has been in existence for several years, advancing interoperability in health research and data in Canada. Challenge area lead for AgeWell, and also on the faculty at the University of Alberta and School of Public Health. Thanks.
Great. Thank you. And Ron, tell us a bit about you.
Thank you, Marcy. Well, I'm trying to be semi-retired, but I still work as a health systems consultant with a focus on bridging the theory-practice gap. I spent many decades in senior management roles in both community hospitals and academic health center environments. And I live on Salt Spring, which is very sunny today, the traditional territories of Coast Salish people. I also have adjunct roles both at UBC and Rural Roads in the School of Leadership Studies.
Great, thank you. Okay, we're going to move on to slide 3, and thank you both for your introductions. And this slide, I just want to do our land acknowledgement. We acknowledge that the Canadian College of Health Leaders National Office is situated on the traditional and ceded territory of the Algonquin and Anishinaabe Nation. We honor and respect Indigenous peoples, their history, and their rights as the original caretakers and stewards of Turtle Island. We are grateful to share these lands and water together, and we're committed to forging culturally safe relationships, to learning, and to contributing to reconciliation. We hope that this is in the spirit that you will join with us today. So thank you. Next slide. So what are you going to learn today? We're going to talk about why is peer-reviewed journal publishing important, the history of Healthcare Management Forum, what makes our journal unique, who reads our articles, who writes our articles, how you in the audience will write an article and submit, and then what happens once you submit that article. Okay, so I'm going to ask Don to talk to us about why it's important to publish.
Well, as you've already intimated, Marcy, there is an incredible influx of information in the global environment. And to say that we're overloaded with information is an understatement. There is disinformation, misinformation. And so what we want to be able to ensure as healthcare leaders, that we've got a system in place which allows publishing in peer-reviewed journals to provide credibility, permanence, and professional curation that social media simply cannot replicate. Authors publish in peer-reviewed journals, and more specifically in Health Management Forum, to validate the scientific integrity of their content. This builds credibility and trust in their work. Publishing in Health Management Forum promotes authors as experts in their field. It acts as a formal and permanent record of innovation, and it increases visibility for their work with people who are not exposed to it otherwise. Among other reasons, authors who have published with us in the past have written their articles to attract like-minded thought leaders and to secure grants. Next slide.
Next slide, please. So, Don, if I'm not mistaken, then publishing helps build your credibility and your resume and provides more exposure. But what do you mean when you say peer-reviewed articles? Like, does every journal ask for peer review? Can you just help us understand what peer review is, please?
Sure. Sure. Well, not all journals require peer review. Health Management Forum does. And essentially, that is the fundamental success of the forum. Reviewers function as a quality control, ensuring that content is valid, original, and significant. You all remember from your empirical sciences that internal validity of what is carried out as a scientific experiment and then external validity in terms of its generalizability are extremely important. So when you're reading a journal article, you want to be confident that all of the checks and balances have been put in place. The insights from peer-reviewed articles are that they answer detailed questions. They provide originality and insight. They ought to be relevant. The scope and focus ought to contribute to the knowledge and to the practice in your area. You can be confident that there's methodological rigor. The use of evidence is explicit, transparent, writing is clear, and ethical codes are adhered to. So the peer reviewer's job is to assess the information and make a recommendation to the managing editor and editor-in-chief on whether the work should be published. We're lucky to have 250 peer reviewers from around the world, and they represent expertise in all of the various dimensions of the healthcare policy, decision-making, and management.
Thank you. So, Ron, maybe you can spend some time to help us understand what is the history of Healthcare Management Forum? How long have we been around, and what are we known for? What's our reputation like?
Well, thank you for that question, Marcy. It's important to mention that Health Management Forum has been around for 47 years, a long time, longer than many journals in our field. Back in 1979, we were called Health Management Forum, and it was founded by the then president of Extended Care Health Services, who was a lifetime member of the college. His name was Harold Olivergent. By 1987, we had a circulation of around 900 people, mostly from Ontario, and we were publishing 4 hard copy editions every year. And back then, HMF was featuring mostly commentaries and best practices. And the early articles included themes that related to things like strategic planning, empathetic leadership, and how hospital cultures were shifting. By 1988, the journal was transferred to the college and renamed Healthcare Management Forum, its current name. And the peer review component was added at that time. And then back in, well, not that long ago, 2015, under my then direction as editor-in-chief, the college chose to publish with Sage, our current publisher, an international publisher, which specializes in working with nonprofits. And it manages over 1,100 journals that span many specialties, including nursing, social work, health sciences, psychology, business, and many others.
That's great. So carry on and tell us a little bit more about this history.
Okay. Well, and then we adopted a paperless approach to publishing, and currently we publish 6 times a year. And our website is on the slide there, content searchable all the way back to 1988.
Wow. So what makes us unique?
Well, we have we think a perfect balance of theory with real world practice. It's very popular. We have readers in 78 countries and a presence in the developing world through the Research for Life partnerships with the World Health Organization. In fact, we have some of the most curious and dedicated readers in healthcare. And in 2025, the full editions of the journal were downloaded for, and wait for this, 330,000 times. So I think that speaks to its popularity.
Yeah, for sure. That's great. That's a really broad reach, 78 countries. So you've told us a bit about how many readers, but talk to us a little bit more about who is the general outreach for Healthcare Management Forum. And I think
Yeah, I
we need the
can't.
next slide, please.
Yeah, I can't give you an exact number, but what I can say is that we have two general groups of readers. Um, and the journal is, if the participants don't know this, we have 4,500 members of the college, and this journal is free to those members. They are the most senior people making decisions in healthcare today, including positions like presidents, CEOs, and senior executives of hospitals, health authorities, national agencies, and large health networks. So a broad variety of readership, and often the most senior researchers who are working on cutting edge innovations. We have 23,000 subscribers from across the globe, all of them institutions. And also until recently, we were indexed in PubMed, Medline, Scopus. And starting January of this year, we're now indexed in the Web of Science, and we'll receive a formal impact factor rating later this year. So really, our readership just keeps increasing year over year. And it's hard to pin down the exact number of people who are reading it, but we know it's growing.
That's great. So who is actually reading Healthcare Management Forum? It sounds like there's a lot of people out there, over 23,000 institutions. So talk to us a little more in detail about who reads Healthcare Management Forum,
Yeah,
please.
this is interesting. These people include people from places we might not think of, like nuclear physics, psychology, neurosciences, law, engineering, social studies, agriculture, IT, and a whole host of other areas. People interested in health leadership and management and policy in particular. Our subscribers also include the military libraries across a number of countries, and we're also read by people at the top universities in the world. For example, McGill, Queen's, U of T, MIT, Stanford, Oxford, and many others. So well read across the globe.
And I think the next slide belongs to you with a continuation of who else is reading the Healthcare Management Forum.
Well, we conducted a readership survey recently, and the results perhaps weren't that surprising. Our readers are using the journal to stimulate their own thinking, make research more robust from their perspective, create resources in their own environments to manage systems change. And we found that, and we want to emphasize this for the listeners today, that the articles that provide a direct link between theory and practice are the most well read. So if you're thinking about what to write, think about that theory practice gap as a point of entry.
That's great. Can relate to that because what you learn in theory and what you put in practice often differ. So thank you.
Yeah.
So how do our readers use Healthcare Management Forum's research?
How do they, sorry, I missed, what slide are we on again? Are we on 13 now or?
12.
Oh, we're on
How
12.
are our
Okay.
readers using it?
Well, again, I think I might have touched on this earlier. They're using it to stimulate their own thinking, make their own research more robust, and create resources so that they can manage systems change in their own environment. And again, an emphasis on the theory practice gap.
Great.
Yeah.
Okay, thank you. So we've established that the journal's publishing is invaluable, and Healthcare Management Forum is our go-to journal in Canada for senior decision makers and high-profile researchers. Ron, this all begs the question for our audience. Who's writing the articles and why do they choose to publish in Healthcare Management Forum and not a competitive journal, one of our competitors? Why do they pick Healthcare Management Forum?
Yeah, that's a great question. So I think the short answer to that is anyone can write at any stage of your career, and authors can be, but don't have to be academics. In fact, we encourage non-academics to write. We need to hear a lot more from the practice setting. The work should be grounded in your practice as an author. And we like to publish those best practices from different communities in the health system. And also something to note is our acceptance rate is 35%. So that tells authors and readers alike that we only publish the best articles from the hundreds that we receive and review each year.
Interesting. Thank you. Well, Don, I'm going to turn it over to you now for a bit, and thank you, Ron, for all your insights. So, Don, I'd like to understand, sorry, can you explain to the authors how, when you're going to write an article, how do you know the people that you want to write for? How do you target the audience that you're going to write for? And how do you just get this whim that I want to start writing and pursue publishing?
Right, thanks, Marcy. So, having had experience teaching critical courses at universities, your critical eye on being able to mentor and help students identify ways in which they can frame their ideas, engage in intellectual exchange that allows them to become masters of their subject area, gives you a fair degree of insight into how they can approach this. So before I dive into the subject matter, I'd like to first of all thank all the authors on the webinar today who have already contributed to Health Management Forum. It's your intellectual input into the body of knowledge surrounding health leadership has helped to advance leadership as a true profession and recognize that it resides at all levels of an organization and not just at the very, very top. So in my opinion, there are a few things that authors will need to think about as they start writing. The first and most important thing for authors to do is to read the submission guidelines on the journal homepage. They contain all the information you'll need to know. And here are some of the highlights. Articles, 2,500 word limit. The references should always be in AMA format. And you are allowed 3 figures or tables or a combination of both, but not more than that.
Okay.
Move on to slide 16.
Yeah, so tell us, how do I know that the topic I want to write about is going to be relevant to Healthcare Management Forum?
Well, as an author, you need to know if your topic is really relevant to Health Management Forum. In today's environment, as all of you appreciate, there are an incredible spectrum of issues and challenges to have to deal with. We are truly at an important information revolution in the global evolution of healthcare delivery. And that's not the same question as will this audience find it interesting? It is relevant means, does it relate to health leadership specifically? And does it address health management or deal with health policy? Is it timely and aligned with the scope of the journal? We receive some articles that have nothing to do with leadership and are not written with the concern of leaders in mind. They are always rejected. There are other journals that would be delighted to receive those articles, but Health Management Forum is not one of them.
That's helpful. And so we want to see original work. Then what questions should our authors be asking themselves before they pursue publishing?
Well, always, and many of the audience will have undertaken undergraduate or graduate studies. And in graduate studies, what you're looking for and what the journal is looking for is new knowledge and creating new knowledge that can add to the store of knowledge that healthcare leaders already have. And can I apply this knowledge in the world? And as Ron pointed out earlier, it can't just be theory. It probably isn't right for this journal if it's only journal. But if you bridge between theory and practice with reasonable, logical consequences for application, it will be very, very appropriate for our journal.
Great, that's helpful. So how do we know it's going to contribute to knowledge or practice? Can you tell us a bit about that?
I could, Marcy. Many authors have a hard time with this one. They will want to ask, is my work really new? How is it different from the work that has been published before? If it is innovative, then think about the format you are using to convey your message. It might be something like a literature review. It might be a scoping review. It may be a case study. And is it best positioned as original research? And finally, it's important to think about how your work may link to the LEADS framework, which all of you will be familiar with. The LEADS capability model is specifically tailored for the health sector. And while it might not always apply to your specific work, it may help ground some of your ideas around a framework. And the LEADS framework is gaining global popularity in respect to its application in other environments.
Well, thank you, Don. So our audience, we assume, understand leads. I certainly understand leads, and as an author myself, I understand how to publish. But for our audience, how do they know what type of methodology should they pursue, and what would you say are sound methodologies to use for publishing?
Well, it's important to know that your work is appropriate for health management forum, what your message is, and how you want to position it. Methodology is another gray area for some authors, and 2,500 words does not allow for a lot of description. Authors will need to think about what points are most important for some of those. And this slide just emphasizes three things, four things, I should say. Keep it brief. What about your research design, data, sources analysis, and limitations? Does it include qualitative meaning and quantitative metrics of information? And are your findings generalizable? In your methods section of your paper, you will want to be very explicit and concise around the methodology that you have utilized, so another reader can understand how it is you've put that information together.
Thank you. So, talk to us a little bit about evidence. What do we need to know about evidence, and what is well referenced refer to?
Well, evidence to support your arguments is key, and consider asking yourself, what is relevant literature and where can I find it? You want to provide somewhat of a synopsis of it for your reader in order to situate your particular project. For example, Wikipedia is not a trusted source, but think about how you integrate the references into your work. As yourself, are my conclusions practical? And it's important to talk about the next step. Does this area of specialty require more study? Do you want to be more specific about where those opportunities might lie in the future?
That's great. So, Dawn, while you're telling us all about this, it sounds like, we've talked a lot about the bones of a great article, but how is an article being written as equally as important? Talk to us a little bit about how your writing should flow and why you're telling us it should be clear and concise and logical. Help us understand what that means.
Right. Well, as you can appreciate, using plain words, punctuation appropriately, and of course, you want to stay away from plagiarization. Keep your paragraph short and don't be redundant. Check the SAGE policy on the use of AI. And SAGE is very explicit, as are all major respected publishing companies, very explicit on what's appropriate for the use of AI and what is not. And finally, proofread, proofread, and proofread. There isn't anything that can match the ability to be able to reframe a sentence into a much, much more concise set of statements. And recognizing that 2,500 words is not a great deal of space, but
Right.
through concision, one can reach that objective fairly effectively.
Great. So in continuing with you touched on AI, and we know you can't go a day without reading about AI somewhere. What would you say are what's appropriateness? What should we know? What should we teach people or recommend to them about AI?
Well, they're very, very important. And of course, we're dealing with these questions in our healthcare organizations, we're dealing with them in our universities, and we are as publishing houses as well. So if you're going to be articulate in respect to the use of AI, it does need to be very, very explicit. Now, there are things that you will want to include as well that you may think, well, I didn't work with human subjects, so why do I then need an ethics statement? An ethics statement is a declaration of responsible conduct, and it demonstrates to the reader that you've considered the ethical dimensions of your work. The same applies to a conflict of interest statement. You foster trust by disclosing in a public, transparent way that your work is objective. You also need to consider if you should be thanking anyone for their contribution to your work. If they directly contributed, then they deserve mention. Many articles are, well, majority of articles today are not Lone Ranger single author. They are teams of individuals that contribute to this. And one thing you will learn as you read the submission guidelines is that HMF does not publish appendices. This is important because 2,500 words with 3 tables or figures may not be enough space for you to include all of your material. This should make you think about what materials are the most relevant, and if you have information that complements the article you've written, you may want to make that information available somewhere else, somewhere where you can direct people to it on request. And all of our articles have a lead author, and the lead author is identified and someone that you can reach out to for that additional information. So never hesitate to pursue that if you require it.
That's great. Thank you, John. That's helpful. So now we've learned all this, and now I feel like we're helping our audience understand they're ready to submit. So what's the next steps, Don? What do we do?
Well, a few things to check before you submit. Have you got an abstract clearly written? Are you within the word limit? Have you received written consent from your co-authors to submit your work to Health Management Forum? Nothing more embarrassing than to have one of the authors on the final review say, well, I don't actually want to be identified here as an author. That can be problematic for you and for the journal. If everything checks out, you can then create an account in Manuscript Central, the system that Sage uses to process all articles, and upload your files. It provides prompts at each stage.
Great. Thank you. So what happens next? I submit my file, and now what?
Well, submissions and peer review are all done in the same system, and
Okay.
Health Management Forum will have feedback for you within a month, 30 days. It's important to work with the feedback you receive and ask the managing editor, who is Lori Wilson, any questions you have at this point. You want to work out all of the bugs before you submit again, and Lori Wilson is more than willing to work with you to help refine your submission.
That's great. Thank you. Next slide, please. So what do the authors do now?
Well, you want to resubmit. You prepare a letter that outlines your changes and resubmit that along with your revised document. You have 21 days from when you received your peer feedback to do this. Then you simply wait for the decision. And just a word as to how to frame your editorial feedback. Generally, I find using a table in which you've got the critique on the left-hand side of the table and then how you've responded to it on the right side provides the individuals that are looking at your resubmission to easily look at how you've accommodated the feedback that was provided to you.
No, that's great. Thank you so much for sharing that. And I want to thank both of you for sharing all your insights. And just for our audience, I have a few testimonials here. We won't read them out because you can read them and you will have a copy of the slides. But just so you know, and I have published, and as you know, Don and Ron have, it is rewarding when you get a letter saying um, your article is ready for publication. Even if you have to edit, it is still worthy of the journey. So that's one of our testimonials from George. The next slide, please. Publishing is really important to raise awareness and contribute to the discourse in health leadership. And I know from teaching students at Western University, lots of times you want to publish, but you're afraid. Don't be afraid. It's really great to do. And we thought it would be helpful for the audience to have some references. So there are some references there, and you will have a copy of the slides. But if you want to grab a quick picture, whoops, before we ask for questions and answers, we can go back to that slide. I do want to thank Lori Wilson, who helped put together today's presentation, and my colleagues Don and Ron. I feel like we're a comedy show here, for their great insights. And we'd like to open it up. We have almost half an hour left, so we'd like it to open it up and have a healthy dialogue with our audience. Ask us your questions, share your insights. If some of you have published and weren't successful, what happened? What are you doing for the next steps? If you were successful, what did it feel like? And how glad are you that you got to publish? So we're going to open it up now for questions. Please either put your questions in the chat or raise your hand. Asada, you can read the questions or I can read the questions as we get them. And we do, like I said, have 25 minutes. So this is your time. Please take advantage of my colleagues Don and Ron's knowledge and wisdom. Any questions? Oops, I'm just looking. I don't see any yet.
Marcy, would it help while we're waiting for questions to be formulated if I just jumped in, and if people
Please.
are sort of wondering how is my article going to be evaluated during peer review?
That would be amazing. Thank you very much. That's
So,
great.
yeah, I think it's helpful for people to know this when their article is undergoing peer review, that there are, I think, about 8 different criteria that are used. The first one is the content relevant to the field? In other words, is it relevant to health leadership, management, or policy? The second one is originality and insight. To what extent does the paper provide novel insights, novel perspectives, or different contributions to the field? The third criterion is the scope and focus. Is there coherence and alignment with the issues that are relevant to the readership? The fourth one is how well does it contribute to the knowledge and practice in our field? Does it advance scholarly understanding, practical applications in leadership, management, or health policy? Fifth is methodological rigor, if it's applicable. This is more of a scientific article, but how sound is the methodology? Sixth is how well evidence and literature is used and drawn from in order to support your arguments in the paper. Seventh is how clear and structured is the writing? Is it logical, well organized, and accessible to the audience? And finally, ethical considerations, if that's applicable, have they been addressed? And Don mentioned that as well, in terms of using human subjects as research, conflicts of interest, the use of AI, and things like that. And of those 8 criteria, the ones that matter the most are, is it relevant to the field? How original is it? And does it contribute to practice, i.e. the theory-practice gap, or the practice-theory gap, as it may also be known. So those are the criteria. Just keep that in mind if you're submitting, just as a general guideline.
Great. Okay, so we do have a couple questions that have appeared. Saiwen Wong, I'm thinking to write on topics of AI in healthcare leadership. Is there any guidance on specific topics around AI or similar topics have been exhausted? Looking for guidance on this topic of AI.
Shall I tackle
Please,
that one first, Marcy?
please.
Yes.
So very, very timely and excellent question to raise at this time. So this fall, I'm teaching a graduate seminar on artificial intelligence in healthcare delivery. And in this course, we're going to cover some of exactly what it is that you're asking about in this question. What is it about leadership in the AI environment that's permeating healthcare that's going to be of greatest interest? I'd suggest the first thing you do is you have a look at past articles that have been written in Healthcare Management Forum on that very topic. And you will find that in the last 10 years, we've published about 10 to 12 articles that have focused in specifically on the challenges and issues that are emerging for health leadership in this particular space. It may be issues around governance. It may be issues that are associated with the ethical utilization of scribes, for example, and how does the leadership of an organization deal with the introduction of that. We're dealing as well with issues of the veracity of the data. And we all know that there are challenges associated with large learning models utilizing information and data from the past in order to conjecture predictions for the future. And we all know there are significant biases within the data that we have historically collected. We do not want to replicate those biases going forward. So, what are the issues that health leadership needs to think about to ensure that these errors or these challenges are addressed really, really competently into the future? I will also mention that I think it'll be in November of this year. We have guest editors, Ewan Efflick and Claire Snyman, that are hosting an entire issue on the question of interoperability of health data within the Canadian context. And that whole challenge has now played itself out in the form of legislation, which was introduced in the Senate, Bill S5, and has to do with data blocking between vendors providing data. So there's a fascinating topic that we would never have thought of 5 years ago as being relevant. So start by looking at what articles have already been published in Health Management Forum and other leading journals in this space. And then begin to think about what practical challenges and issues you're dealing with in terms of interprofessional linkages in the sharing of data and providing codes of conduct around the use of generative AI. So this is an entire field that is ripe for further analysis and thoughtful recommendations for moving the agenda forward. Your thoughts, Ron? I
Whoops.
think you're on mute, Ron.
Thanks, Don. I think you covered the sort of the topical areas for the use of AI. I'll just refer though to another aspect of AI, and that is how you use AI or not during the publication process, because there is a lot of publications ethics around the use of AI. And I think we're quite aware we don't need to disclose the use of AI when it's used for editing, like improving language and grammar and structure, those kind of things where it's an assistive tool. But there's ethics around how you need to disclose AI as well when it's being used. It's things like if you're using AI to assist you with a lit review or compiling relevant sources of literature, that needs to be disclosed. You need to disclose if translation of materials was used as part of a research process, for example. If you've used software generated by AI to undertake additional research, if you've used AI to help visualize data, if you created infographics and illustrations, for example, and assistance with a compilation of references. That all needs to be disclosed. And there's also a number of areas where AI is prohibited from use. And these are all on the SAGE website. And these are good examples to keep in mind where generative AI is inappropriately used. Things like generating incorrect text or content, generating data as a series of prompts, conducting interviews with Gen AI, analyzing experiences and themes. Plagiarism, of course, is an obvious one. Generating images that are presented as unique when in fact they're not, that sort of thing. So these are the kinds of things to keep in mind where you can and can't use AI, and if you are, how it needs to be disclosed.
That's great, thank you. We have received a few more questions. So if you need help in having an expert opinion, where are some of the resources a writer can go to, or an author, for some expert resources?
Shall I start, Marcy?
Please do,
Yeah,
Don.
go for it.
Okay, so Prachi, that is an excellent question. And the best way to think about this is, first of all, bounce the idea off of your peers, the individuals that are around you, either from your work setting, or it might be that you're in a class in which you're taking a course of interest, etc., for continual learning. Bounce it off of those individuals and then conduct a quick systematic review. And this is where artificial intelligence can become extremely helpful, where you would set up the boundaries in your generative AI to expect that any responses that come back to you from the AI are perfectly grounded in authoritative sources. And those authoritative sources need to be cited. So you can go back to the originals to look at their relevance and their applicability. Also, look at finding some co-authors or mentors that you can work with to sort of flesh out the content of the topic that you think is relevant. Generally, these things all require teamwork in order to be able to be addressed, and they're very, very broad kinds of resources. Now, what kind of resources are available to you? The University of Ottawa has a program called Journeyology. And in that program, we have leaders that are providing advice on how best to structure an interrogation of an important subject of research. You'll also find, if you are in a location where there's a graduate program in health management, leadership, and delivery, there will be individuals there that may be interested in providing mentorship around that. So there's just a few sources of expert opinion that I'm sure would be available to you without it being too exhausting in terms of pursuing further.
Great, thank you.
Yeah.
Next question says, articles in healthcare management forum tend to have quite a variety in terms of subject matter. Is the connecting factor leadership rather than a specific area of care? And sorry, do peer reviewers get matched based on discipline?
Good question. Leadership is important and it is necessary, but it's not everything. Leadership occurs now, from our understanding, from the way a continual learning healthcare system works, is that leadership takes place at all levels of an organization. So it could be at the lowest unit of functioning, or it could be at the governance, political, policy level. So it permeates all of those. The important thing, as we mentioned earlier, is that if you use the LEADS framework to think about, so how is this article informing ways in which we can more effectively lead ourselves, enable others, and the other elements within the framework to be actualized, you've actually written the concluding remarks of your particular article. So leadership's not all of it, but it is an important element. Now, in terms of the spectrum of care, we're now moving towards an understanding that social determinants of health and the broad aspects of social economic conditions in our society contribute to a nation's and a society's health. So we're looking now not just at healthcare delivery within an institutional setting, but healthcare delivery from other elements within the community. And these will involve mental health services and addictions, for example, in which we're facing immense issues with homelessness and with individuals dying as a result of overdose. So broad spectrum, keep the lens fairly broad, but hone in at least for some understanding of leadership can help contribute to solving the problem.
Great, thank you.
I may jump in there too,
Yeah,
Marcy.
please do,
I
Ron.
think there's a question in there about peer review and matching, and I think it's safe to say that Lori Wilson, her managing editor capacity, has a pool of about 250 reviewers and will match the content of the article with the most appropriate peer reviewer, which I might add is double blind. So the reviewers don't know who the author is and authors don't know who the reviewers are.
That's
Just
great.
to answer that part of that question.
Yep,
And just
no,
to
that's
back up
perfect.
to another question in terms of resources, I'm not sure how many people are familiar with Google Scholar, but there's also Google Scholar Labs, which is AI generated, and you can ask very, very specific, in ordinary language questions, and it will give you prompts as well. So you can find anything you want using Google Scholar Labs. Just refine it as much as you can, and it'll zero in on the latest articles and onwards, and it'll allow you to refine that question even more as you get answers coming in. So I'd use that as one of the first line of resources as well. And it also to go on websites of different agencies, because often there's a field that has additional resources that you can go to and click on and have a whole cadre of other resources in that specific area.
That's great. That's helpful. JR has a question just to confirm or clarify. Sorry, my email pops up. Is it possible to submit an abstract to Healthcare Management Forum of an article idea to determine if it's original enough to pursue?
I'll speak on behalf of Lori Wilson at this point and say she is always open to bouncing ideas around and helping potential authors refine them. We're also very interested in hearing of individuals that want to structure themselves around focusing on an entire issue, looking at a specific theme. So it might be the issue of governance and AI, for example, and then finding authors that would contribute to that. So Lori is the best sounding board to explore those kinds of ideas.
Great. Ron, anything to add?
Yeah, I'd just like to emphasize again, we talk about the theory practice gap and where the articles of most interest are the articles that bridge theory practice. And it's interesting we put it in that order because I think we need to reorder it in a way to say it's the practice theory gap as well, where practice can inform theory. And we need to hear a lot more about what's working or not working in the field from the perspective of the practitioner so that we can adjust theory, not the other way around, which has been more of a traditional scientific approach. So I would really ask you to really think about what is in your work life that's really on your mind that you want to make a difference in, that will be fun to do, and submit that as an idea and see if that can gain traction. So again, just an emphasis on the practice theory gap as opposed to the theory practice gap from the practitioner perspective. We need more of that. And not just what's working, but what's not working, the challenges, failures, how it was dealt with. And there's a publication bias in terms of often what works gets published, but we need to learn a lot more about what's not working and what's challenging so that others can learn from that and not make the same mistakes over and over. We need to have more of those kind of articles as well. So just to pitch a practical perspective and not just what's working well, but what were the struggles and challenges that you faced and how that might affect theory as well.
Great. Thank you. Which dovetails nice into our, I think, our last question. Do you accept systems theory frameworks that can be applied in practice or in the future? Would this framework be better suited to publish after implementation with, whoops, sorry. I'm just trying to get it with explicitly identifying limitations or future implementation implications?
That one's over to you, Ron.
Marcy,
Difficult.
I hate to ask you, but could you repeat that? I lost the thread there. Sorry.
Can I, sorry?
Can you
read
repeat
it?
the question? I lost the thread.
Yeah, sorry. I'm just trying to get it to show up on the screen properly.
It was a
So do
long
you
question.
accept systems theory framework that can be applied in practice in future, or would this framework be better suited to publish after implementation?
I'm not sure I'm getting the question.
Yeah,
Don,
I can
With
take it.
explicitly
Actually,
identifying
you,
limitations or future
yeah,
implementation. Yeah.
you actually partially answered the question, Ron. And systems theory is extremely relevant. And I think the point that Ron was making earlier is relevant here. We do need to have systems theory linked to some sort of practical outcomes
Whoops.
or pragmatic implementation strategies. So, systems theory on its own, I think most people are quite familiar with the content, but how is it being utilized to best advance program delivery, governance, or leadership would be the best way that I would frame that.
Okay, thank you. And again, if people have questions, you can definitely send them in. Lori will help navigate where the questions go. And I think there's two left. I'll just try and read this one to you. Sorry, they don't appear on my screen properly. So this
Uh,
one's from Audrey. Regarding putting theory into practice, can authors ground their work in explicit theoretical model to inform a practical approach? Or is there an expectation, sorry, that the article consists of operationalization of the theory through a formal study? And then she asks, for example, my research background is in leadership communication to support bridging divisive issues such as COVID-19 or vaccination, which have been published in, and I'm so sorry, political philosophy. Would it be appropriate to propose a practical application informed by a theoretical work?
I think the short answer is yes. Expand on that. That's the right idea. Integrate the theory into practice, and they're right about that. So the answer is yes, if that was the question.
yeah.
And our very last question says, for special issues, are there different submission guidelines? Or are the submission guidelines the same as all issues?
The submission guidelines for the articles will have to meet the same peer-reviewed criteria that Ron spoke about earlier. The difference is that the guest editors get to structure the content by virtue of a thematic linkage of the broader topic to specific articles that are invited with the authors and with the titles of the articles. If you're interested in more information about that, just speak to Lori Wilson about that. And I think you can get an appreciation of how that can be quite a valuable way of sort of saturating the space with new knowledge in that particular subject area.
Perfect.
Yeah.
Well, those are all our questions, and I know there's a couple more slides. Sarah, next slide. Whoops, one back. Sorry, quick. So I just want to thank the healthcare management for working group for working on this, and the three of us that are here today, plus Jean-Francois Landry. This was an idea that we thought we would love to share with everybody about how you can publish and to make it sound a little less scary, because I hear from students all the time, oh my gosh, I can't publish, it's so scary. It's not scary. We've done it. We encourage you to do it, and we are here for you. Next slide. And if you need more information, as we said, Lori Wilson is our godsend. She is amazing. She helped me with my first publication many years ago, and we all love her and thank her for everything she does. And please reach out, and we look forward to seeing some of the names today in our newer publications going forward. So I would like to thank my colleagues, Don and Ron, and
Thank
thank
you.
you all for being here today in attendance. It is great to see so many people interested in publishing. So thank you. Any closing words, Don or Ron?
No, just encourage all of you to think about that research to practice gap and
Yeah.
ways that you can contribute to it. Health Management Forum is a great way to exercise that.
Yeah. And treat it more as a fun thing to do rather than a chore. Have fun doing it.
And on that note, it's 12:57, so thank you all for attending today. We really appreciate your spending time with us, and have a great afternoon, everyone. Take
Bye-bye.
care.
Thank you. Bye-bye.
Bye.